Hello, my name is Vlad. I'm a nurse practitioner student. We'll start your interview. Um, Thank you for coming in and giving me the opportunity to examine you. Can you tell me your date of birth, please?
12/26, 79.
Okay, thank you so much. And tell me a little bit about what is the reason you're coming in today? Oh my God.
Well, I've been having painful periods.
Okay. And can you tell me if this is a new problem or an old problem? How long has it been going on?
Um, well, my periods have been heavy and painful, kind of over the past 5 years, about.
Okay. So, more recently, what made you come in today? Has anything changed, or
I guess it's just become even more heavy and more painful, and I'm having cramping and jaw ache.
okay?
And the symptoms started like a day before my period and last until the 6th or 7th day.
Okay, so start one day before.
And I'm here for my general physical exam and
Okay, thank you so much. Okay, so how long are your periods? How long do they last?
generally 7, almost to 8 days.
So the pain lasts in total like 9-10 days, or
It generally tapers off by about the 7th at the most, so like the last
so for
day.
7-8 days, because you start hurting the day before, correct?
Yeah.
Okay. And can you point to the location of your discomfort? Where is that? So
Right.
it's on the left side you're showing, so left
Left
quadrant, left pelvic. Okay. And does the pain radiate, or does it travel anywhere when it occurs?
It kind of goes around my back and down my legs,
Okay.
thighs.
And it has been always radiating, or has it changed recently?
It's pretty much always done that to some degree.
Got it. And have you tried anything? What makes it better?
Pads and hot baths seem to help some, and I'll take ibuprofen every 4 hours or so, and that helps a little.
Okay. And what is the dose of ibuprofen? Those two, are they 200?
200, yes.
Okay, so 400 milligrams each time. Okay. And anything that you've noticed that makes it worse?
Not really worse, but it's just I have more pain with intercourse.
I see. And can you tell me what you mean by more pain? Can you tell me the severity from 0 to 10 scale, please? 0 no pain, 10 worst you've ever had?
Well, it not really. It just makes me not want to have sex.
Okay. And so does the pain change in the morning versus in the evening, or it's constant?
Yeah, it's pretty constant.
And what is the pain number, please?
Oftentimes it's 7 to 10, or 7 to 8 out of 10.
Okay, thank you so much. Okay, good. All right, thank you for sharing all of that. Thank you for your trust. I will proceed to review your systems. I will ask you a few general questions about your health overall and your general condition. Do you have any fever?
No.
Any chills?
No.
Any fatigue?
Not really. Just kind of tired of this cycle.
And night sweats?
No.
Night sweats? And how about weight changes? Have you gained or lost any weight because of it? Or recently? No. And we'll move on to your abdomen questions. So have you had any nausea or vomiting?
No.
And diarrhea?
Some mild during my periods.
Okay. And constipation?
No.
Have you noticed a change in stool as far as color, bloody stools or tarry stools? No? Okay. And when you have diarrhea, is it really watery, or is the stool just getting soft and it's mild? How
Yeah. Just
soft?
yeah.
Okay. All right. And let me ask you about. Have you had, or do you have any flank tenderness either on either side, like on your side, on the right or on the left?
I don't think of it as, it's more just lower back.
Lower back, and you're pointing to the left side.
Or no, I'm going around to my the spine lower back.
Got it. Okay, thank you very much. And do you have any back problems? Have you had any problems with your back? No. Okay, thank you. And have you noticed any bloody urine, hematuria, any painful urination?
No.
Okay, any discharge or itching
No.
from vaginally? No. Have you noticed any lumps or swollen lymph nodes in your groin?
I haven't, no.
Okay, thank you for sharing that with me. We'll proceed to ask you about your past medical history. Have you ever had, this is, I understand, it's a sensitive topic and it's very personal, but have you ever had sexually transmitted infections?
I have not.
And diverticulitis?
No.
Any Crohn's disease?
No.
Kidney stones?
No.
Have you ever been anemic?
No.
Okay. And have you ever had any surgeries, either on your abdomen or on your pelvic area?
No.
Any GYN surgeries? No? Thank you. And do you smoke?
No, never have.
Okay. Do you drink alcohol?
No.
And do you use marijuana or cocaine?
No.
And can you tell me about your diet? Are you...
I'm trying to eat a well balanced diet. You know, I have a daughter, so I'm trying to keep her healthy along
Okay.
with my husband.
Thank you for sharing that. So you live with your daughter and you live with your husband, you said? And are you in monogamous relationship?
Yes.
Okay. And is your husband also in a monogamous relationship? Do you know?
Say that again?
Is your husband? Does your husband have any other partners besides
Not
yourself
that
as
I'm
part of your
aware
marriage? Okay, thank you for sharing that. How much coffee do you drink?
How much what?
Coffee do you drink? Do you drink any coffee?
Oh, 2 a day.
What, 2 per day? Okay. And do you drink enough water?
I try to drink at least 2 for every cup of coffee I have.
Okay, so you drink like what, 8-ounce glass
Yeah,
or more
yeah.
or less?
Actually, I have like a tumbler that's 16 ounces, so I try to drink at least 2 of those a day.
Okay, okay, very good. And what kind of work do you do, man?
Looks like I'm a stay-at-home mom.
And how old is your daughter?
4 years old.
Oh, you must be busy. Okay. Is she all potty trained? Okay, very good. Any possibility you may be pregnant?
I don't think so, but anything's possible on that realm.
What kind of protection do you use, or do you practice any protection?
I'm on birth control, but other than that, we don't use a condom.
Okay.
Or anything.
Okay, got it. So you're on birth control pills. And are you consistent on that?
Yes.
Yeah, okay. All right, very well. And one more personal question. How many sexual partners have you had ever?
Only one in the past 7 years.
Okay,
So that's my current husband.
got it. Okay, thank you so much. Okay, let me ask you about your family. Think about your grandparents, your parents, yourself, and your brothers, sisters. Do you have any brothers, sisters?
No.
Have you had in your family any GYN conditions, cancers, breast cancer, uterine cancer, cervical cancer?
The only family member is my mom, and
Okay.
was diagnosed with breast cancer, and she's currently, they say she's in remission.
Okay, so mom, breast CA. Okay. And how old was she when she was diagnosed?
55.
Thank you so much. And any congenital or any autoimmune diseases that may run in your family, any chromosomal or anything?
Nothing else. Pretty healthy.
Okay. And are you allergic to any medication?
Sulfur.
Thank you. And what happens when you take hold?
Oh, like, it's all over. Like a wrap.
And you stated that you take medications and you take birth control. Do you remember the name of them?
So that's pretty 21.
Okay. And anything else you take?
Multivitamin.
And you also mentioned that you take ibuprofen, correct?
Correct.
And any herbals that you take? Negative on herbals. And how about your immunizations? Have you ever had human papilloma virus immunization, HPV? How about flu shots? Do you get flu shots yearly?
I did get one this past year.
So flu shot is current, HPV not. And how about your tetanus booster? Have you had that in the last 10 years?
Yes.
How long ago was that?
Last year.
So 2014. Thank you so
And then I got the protect, made sure that the pluses was with that.
much. Okay.
Because it would be top.
Okay. Very good. So, have I missed anything? Did you want to tell me anything else? Thank you. I will proceed to my exam. I have done her abdominal exam. Do you want me to do it? Okay. Okay. Sure. Okay. All right. So. Okay, Jessica, would you be able to lay down for me here, please? I will feel on your tummy and palpate it a little bit and listen and so on, okay? So, we're doing inspection, percussion, palpation, auscultation. So I inspect for symmetry. Her tummy is obese but symmetric. Veins are normal. No ascites or normal venous patterns. I will percuss very lightly, okay? So, we'll go through all your 9 regions. Sounds are dull and normal again. I will lightly palpate your tummy. If you're tender anywhere, I know you have a tender spot on the left, so I'll start in your non-painful area here first, okay? We'll go lightly first. Any tenderness with that, you let me know. Right away.
Okay.
Are there any tender? Okay, and I will palpate a little bit on you first. Is your appendix, by the way, in place, or have you ever had that appendix removed? It has been removed?
Yeah.
So right here is a tender spot right here. Okay. And when I press on it, like so, how much does it spike up? 0 to 10? How with
Like up to like a 9 or a 10.
Very severe. Okay. All right. Okay. I would palpate for lymph nodes as well. Should be in a gown, obviously. Okay, you may go ahead and sit up if you want. Go ahead and lay down. Sorry. My apologies. Auscultate as well. Your bounce now. Your bowel tones are present. Have you had a bowel movement today?
Yes.
Okay, great. Thank you. So then I proceed to doing both examinations. So the lymph nodes are different enlarged on the left side. So I felt a centimeter and a half. Semi-firm lymph node in the area. Also, my findings are so probably she has no lesions, she has no vaginal or cervical discharge, she has vaginal tenderness, and no emotional tenderness, so she also has that progressive tenderness and resentment around them. So my diagnosis, I suspect, together with the rest of the answer, I would order the check it out. Not for timidness, whether emergency or a pregnancy that is a rupture. Potential also potential disease, unnecessary thrombosis, unlikely or indefinite. I would treat her with machine with either ibuprofen or sustatin, investigate whether to give her public time for breakthrough as well. She can alternate those two. Continue eating well, drinking well, and also to change her rest from 6.4 to 24 and give her a little bit more hormonal coverage and perhaps for painful periods with lighter better.
There we go. Okay. You want to come back? Good.
Yes, please.
Okay. You did a great job with the HPI, and I really appreciated how you asked about how your symptoms have changed. So, it's been going on for 5 years. So, why are you here now? I really appreciate that question. Great job with asking about what makes it better and worse. She gave her some specific examples of what she's trying, clarified the ibuprofen, and really, I don't remember hearing is like the quality of the food. So does she feel like it's a cramping, shooting, stabbing, burning? So clarifying a little bit about what the quality.
I switched from HPI, PQRS to all parts iron, but still, but character is here, so that's quality quantity. I should probably go back to PQRS. It's more specific because you use that. So.
I like that.
So, thank you.
And then you also want to know what the patient thinks is going on. So is she
I
worried
had that
about,
is
she worried about, an ectopic pregnancy? Is she worried about cancer or something like that? All right. Your review of systems was excellent for general, constitutional, GI, in GU you asked about, blood in the urine, dysuria, urethral discharge, or pain with sex. I want to ask a little bit more about the urinary symptoms of frequency, urgency, any urinary incontinence.
See, just the 31 incontinence doesn't click, but I mean, I assess older patients all the time.
Sure, yeah. If she has something like urinary, something going on, such as cystitis, airlow, maybe having cream disorder, she might have developed some new onset of something like that, and be very embarrassed about telling you about it.
Thank you. Yeah, sure.
Past medical history. You asked about any kind of GYN procedures. And when you said debridement procedures, I appreciate how you clarified that later. So any kind of surgeries on your cervix, your uterus, your ovaries. Also clarifying because patients aren't going to necessarily understand GYN. Yes, about STIs, medications, allergies, hospitalizations, immunizations, especially HPV. So great job with that. I want to ask more about past pregnancies. So how many times has she been pregnant before? I really appreciate how you asked, do you think you're pregnant now? What about pap smears? What was her last pap smear? What has she ever had abdominal infections? Has you ever had vaginal infections before? So not only STIs, but yeast infections, bacterial vaginosis.
We should have that with
It's all in your book. This comes
No,
straight
but
from your book.
we read the book. Trust me. I mean, I read almost every word for word, but it just there's just so much.
Great job with family history. Excellent job with that. Great job with social history. So yes, about tobacco, alcohol, drugs. And I really like what you asked about specifically marijuana, cocaine. So people aren't going to necessarily think that marijuana is a drug that lives legal. So asking, specifically. Also clarify her water intake. And I really appreciate how you asked about caffeine. It's huge because that's a big bladder irritant. And so if people are drinking a lot of caffeine, soda, any kind of bladder irritants, they're going to be going to the bathroom more. It could be causing pain or irritation. Yeah. We want to know more about is she able to go to the bathroom? So she's got a 4-year-old, she's very busy, probably running around the house chasing after this 4-year-old. Is she able to take regular bathroom breaks? What about her cleansing routine? Does she use any powders, perfumes, soaps that could be causing irritation? You did a great job of asking about sexual partner and sexual preference. Good job. Great. Physical design. I think the only things to remember is checking for CV.
Yeah, I guess. Do you, I mean, sometimes, to supply more students with a test, sometimes maybe too much, or maybe deemed as, cool or something, do you,
Yeah, sometimes people do, like, they'll put their hand here and then they'll just
over
tap.
the hand maybe?
Yeah, but
okay.
you don't necessarily need to do that.
Yeah.
And really, if somebody has pylo, just like that gentle tapping like this, they're going to jump off the table.
So could you do like a percussion? Or
Probably
does it
not.
have
It's
to be
going to be with
Okay.
It's not, because that's a region kidney, so the wave reach the deeper tissue in the
Yes.
kidney.
Yeah. So it's really not that hard. I mean, you're just doing a light tap.
Yeah.
But really, if there's any kind of inflammation, they're going to be like shoots. They're going to be
because
touching
that
the ceiling.
doesn't hurt at all. But if there's something underlying, okay.
Okay.
Great job. Okay, good. All right, Becky, you ready to go?
I believe I am.
All right,
Wanna-
let me see.
I think you guys got a